So, welcome to the All Things Endurance podcast. I'm your host, Rick Prince, and I'm delighted to have on our podcast today Dr. Lawrence van Lingen. I'm so excited to have him on. For those of you that were aware, we just hosted our conference, the USCA conference, about 2 weeks ago, and Lawrence van Lingen was one of our presenters. He presented two sessions, and the feedback that we got was just overwhelmingly positive. So, just another reason to bring him on. So, Lawrence is a structural integration specialist, and he's worked with such athletes as triathletes Jan Frodeno, Flora Duffy, Taylor Knibb, so some pretty high-level athletes. He was a high-performance manager for Red Bull in South Africa, and he's worked with a slew of other athletes. He's relatively local to where I am up in Boulder, the epicenter of all things endurance. So welcome to the podcast, Lawrence.
Oh, thanks, Rick. Thanks so much for having me and for the very warm and flattering introduction, I think.
Hi, welcome. Well deserved. So before I get started, or before we get into the meat of the podcast, perhaps you could sort of just tell people, I guess, what a structural integration specialist is, and also just maybe more about your background.
So I trained as a chiropractor in South Africa, and then I did sports chiropractic. And then I sort of really I honed my skills in doing strength and conditioning, rehab, working with teams, doing fitness. I was a fitness and conditioning person for rugby teams at quite a high level. So I ticked many boxes. At the moment, structural integration is probably because I work more with fashion, really trying to treat the person as a whole. Structural integration is the umbrella that it's the license that I practice under, where we predominantly doing movement, fascia, nerves. So it's not that well known. It's some people know it as rolfing, which I don't like, because I think it's moved on from there, but it's pretty much it helps me, with have a license and something to practice under. So I practice structural integration, which is kind of, again, trying to have a big picture look at humans and how they all fit together, which I feel is kind of a lost art, or it's certainly not taught. It was something that I thought when I went to go and study was, oh, I understand how everything fits together, but we were sort of taught all the components, and then I think you left to figure out how it all works together for the rest of your practice.
Yeah, no, I would agree with you, which brings me to my next question. Again, I can't speak to how it is in South Africa or other countries, but certainly within the US, I would say that running gait, it's solely viewed through the lens of the musculoskeletal system, and typically in isolation, right? Like the hip or the knee or whatnot. And as you alluded to in the previous question, your take on it is quite different, a more holistic, sort of integrated model. Could you explain that just a little bit more, if possible?
Yeah, I think look, you have to have some mechanistic model to start your journey, or to have a framework of understanding. Knowledge doesn't sit on top of anything. But at some point, we need to recognize that you cannot separate motion from emotion. They're the same root word. How you move and how you feel are absolutely linked. And then you can go and play around with this as thought experiments. You can sort of be tight and angry and run angry, or you could be open-hearted or curious and play around with trying to hold strong emotions and feel how it makes you move. So I think that's a big part of that people don't recognize is that sort of emotional component. And I think, one of my talks was about communication and the high performance of sort of oxytocin, which is kind of your bonding or your love or your trust hormone. And neuroscientists are sort of getting into this now in neuropsychology. We're really starting to understand that we are a product of our environment, and how we show up in the environment massively influences our response to training, our mitochondrial response, sort of your hormone profiles. And we can understand these in parts. We can understand, oh, well, there's circadian rhythm affects melatonin, affects mood, affects sleep, affects response to training. So I think a lot of what I do is focus on the not that tangible things in running that really make a big difference and really move the needle. So I think that's a good way of explaining it. And one of the things is how we show up in the world, and you know, the best example is like you can have a rescue dog, which is like tight and guarded and defensive and, let's say, braced. And you can approach the dog with love and trust and put your hand out. It might bite you. It might not receive the treat that you want to give it. And a rescue dog behaves in a very, very certain pattern and shows up as a certain pattern. If you touch it, they're hard, rigid, guarded. And yet that same dog, if you can get it to relax and unwind, it'll become a floofy puppy and it'll be trust. And I tend to think humans flourish better from a position of trust and open-heartedness, and we move better, we move with less tension in the joints, and we have, in running specifically, you're way more efficient if you hold less tension. And again, from that point, you can start, you know, like people are trying to mechanically foam roll out tension that may actually just be your perception of, or you're stuck in a certain state or a pattern, rather than, you know, I need stretching, or I need foam rolling, or I need, you know, these sort of external agencies where the root cause might just be learned patterns of behavior.
Yeah. Well, that I love that analogy with the rescue dog. So I guess this is sort of a segue and something that I didn't have in the notes. Do you view sort of the sports psychology, or at least the, you know, bringing that element in, as far as, again, looking at the body as a whole, then sort of the, maybe not the final dimension of human performance, but I feel like it's something that athletes will, you know, they'll be aware of, the whole mind body connection, and they'll say, okay, that's important, but oftentimes it kind of stops there. You know, it never really gets in. You know, in your talks, you know, you had such incredible stuff, you know, those anecdotes saying how people, you know, were kind of last on the national team, thought about quitting, and within, you know, within changing coaches, and just because they were able to relax more, within a few weeks, now they're number one. I mean, it's just incredible.
Yeah, you know, I think, so if we get into running mechanics, you know, people have strong opinions, or you might have your reputation or your current practice in a certain paradigm. And then, you know, during this talk, maybe we sort of, you know, I have a different view. And so for people, if I say things that kind of rubs you up the wrong way, or you don't believe that, what we're trying to do, I think, is future-proof you. I think there's going to be a big shift. I think humanity is more important. We have AI now, whatever that means, but, you know, we sort of know what training programs should look like. We sort of have a general idea, a pretty good idea of a lot of things, but I think that the opening up and blossoming sort of frontier is actually the humanness of humans. And what's happening is, like let's say there's a lovely talk by Kristen Holmes from Whoop I was listening to on circadian rhythm. We've got big data numbers now where we're tracking health and fitness and metrics, and there are certain like frameworks or guidelines that we are not going to escape from, and they make a really, really big difference. And we're kind of blind to that because we're so stuck in the thick of small, whatever, the thick of thin things. We can't see the woods for the trees, right?
Yeah.
And I think this big picture, zooming out, once you start getting a handle and respect the big picture, then you start realizing, hang on, maybe this cue or this aspect of what I'm working on doesn't actually align with the big picture. And at the forefront of that is, as well, I mean, there's guys like Andrew Huberman, who's, you know, but that kind of knowledge of the neuroscience, what makes brain happy, how hardwired our nervous system is, how sort of we basically the product of our habits. And you know, I think the neuroscience is opening up doors to understanding the human on a very, very deep and profound level. And I think we've been trapped in a muscle or you know, people think muscles move you. You go to the gym and you get strong muscles and therefore you're better. Now, you know, now we're starting to go, oh, hang on, you know, muscles listen to nerves, and what's dictating how the nervous system like works or responds, and why do some people really respond to training and other people don't respond to training? You know, that's where the gold is. You know, and a lot of people are just sort of stuck in a very mechanical, mechanistic, you know, we want to do more drills, more strength, more speed, you know, there's more muscles move you, you know, and with super shoes brought in this notion of elastic energy return, and people are starting to realize, oh, there is this fascia, this sort of connective tissue that joins everything together, and we can move with efficiency and ease and elastic energy return system. So I think there's a whole try not to get stuck in a viewpoint. Try and start realizing you need to really zoom out and look at the big picture, and how whatever you're doing fits into the big picture is really, really important. And there are incredible gains to be made when we solve environmental or situational conundrums, you know.
Yeah. You had said this in one of your conference talks, and I read this interview you did in the past, or I think a podcast, that
Yeah.
you typically, your clientele, I love this, is typically elite and desperate.
Yeah.
You know, people in would you say that that's largely because kind of what you just spoke of, you know, these elite athletes, they've worked with coaches or other specialists that have really focused on all the standard things, right? Like
Yeah.
biomechanics and all these, you know, like all those data numbers, and
Yeah.
then they're not getting the results. So like, oh my God, okay, I got to find someone else who looks at this a complete different way, maybe a contrarian view to this. Is that sort of what you're finding, that, you know, people that, oh, nothing else has worked for me, I'm going to see
Yeah.
this Lawrence
Yeah.
character.
Yeah. Yeah. So elites, one of the reasons elites respond is they have a really good sense of body awareness. And so, you know, if you can make a positive change, they can pretty quickly tap into that. Whereas because that's their job. Their job is movement. And generally they're pretty good at movement, or pretty good at noticing change of movement. Or, you know, someone that trains hours and hours a day, reflects on it, their job is movement. You know, you I don't know, like you're cycling and suddenly you see your watts go up and your heart rate go down, and it feels better and the discomfort's better and the sensations are better. They're into that. They you know, as soon as you started to improve their performance, they're not that interested in anything but improving their performance. You
Yeah.
know, their opinions tend to leave, and they just want to welcome in improved performance. So elites
Right.
are often easier to work with from that point of view, or
Mm.
people that are really skilled in movement, like dancers or people that grew up doing gymnastics, or, you know, very body aware. And then yes, desperate people, because let's say, you know, for the average person, a lot of the time, well, no one's average, okay, but like for a non-super elite athlete, they might find they're deeply invested in a certain amount of learning, and, you know, they've done a lot of strength in the gym, and a lot of, you know, they've got a whole model, and they've put time, effort, and money into it. They don't really relate to someone that starts to say that's actually not that important, or you could do this differently, or some of what you're doing is counterproductive. I totally get that. And
Sure.
I think, you know, typically, often when I work with with an elite athlete, or someone comes to me with a problem, I say, look, you got to understand is that I solve problems not by doing what you're doing, but knowing more.
Yeah.
I solve it probably laterally, which means I'm very much outside the box in terms of how we solve things. And that's how I can help people solve problems that possibly other people can't.
Yeah. Gotcha. So as I mentioned before, you know, the only thing I know about, you know, as far as how working with Runner's Gate, you know, is based
Yeah.
on the US and things that I hear. Does Are you aware of, or is this something that you know, that within the US here, the view of how people view gait or running form differs from that of other countries, whether it be in South Africa, Europe, or any other areas?
Yeah, I think so. I think, you know, America's pretty just, you know, America's extra, you know, like we like to do things bigger, better, harder, faster, right?
Yeah.
Um, and I think everyone can understand that if you know, completely different culture, like if you go, I don't know, like let's say you go to India, it's going to have a completely different cultural narrative. So the big pictures that I think America's really invested in is one is Stuart McGill and stiff spine mechanics, which he basically, Stuart McGill wrote the textbooks for all the strength and conditioning coaches, all the physios, all the chiropractors, all the medical doctors. It you know, if you get certified, most of that is based around a sort of a stiff spine paradigm. And for me, it only takes you so far, and then has its limitations. I really don't think we should be running with a stiff spine. I think it's just counterproductive. And I'm more into spinal engine, using your spine in a healthy way to help enhance your movement and move more. But, you know, like everyone's entitled to their worldview, right? But I think that's one of the components of America. And then I think there's also, it's not everywhere, but there's a notion of pulling back with your hamstrings, almost like skateboarding. So you pull back with your
Mm.
hamstring. Some colleges, I mean, when you get there, the first thing they do is rewire your gait mechanics into pawing the ground backwards or hitting the ground with a backward with a backward traveling foot, you know, and a hamstring contraction, and the hamstring then shortens through that gait cycle. And for me, that's a very, very risky play. I think we need to stand on a connected leg, travel forward, and then straighten your leg. And that seems to be the best way to store elastic energy in and sort of open up your hips. So I think that can be pretty uniquely American. And, you know, that's typified by, let's say, the B skip, you get the A skips, B skips, C skips. I think the B skip. You know, in Europe, it depends. There are some different sort of drills. I think people don't attach that much. Here, like, drills pay the bills, or there's a notion that you won't run well unless you do drills, and the way to learn how to run is through drills and cues. So I think that's kind of a uniquely, well, you know, in America, that's a very strongly held opinion, or more strongly held belief or opinion.
Okay.
Elsewhere, you learn to run, and then drills help polish things off or help refine things. But you training volume and how you train is almost more important than the drills. And I think another uniquely American sort of paradigm is I've heard it said by someone I really respect that there's no difference. I haven't read the biomechanics book, but there is apparently one. There's no difference between sprint and running biomechanics, and for me, they're totally two separate things. And especially in America, sprinting is sort of viewed as clean at the back and a very front-based sport. So these guys are hitting the ground backwards on their forefoot and pulling back, and everything's front biased. And for me, running, everything's back biased. It's extension. You land, you travel forward, then you extend. So there's this delayed impulse in your running. You first land, you don't do anything, you travel forward, and then you toe off. So I think that's the big one. And then there's one more. I know it's a lot. A forefoot. I think there's a nuance out of Bowerman and possibly Oregon. You know, I've encountered a few athletes that ended their career prematurely because of it. There's a notion of forefoot running or sprint running. You need to run on your forefoot. And, you know, for me, that's not sustainable. You can certainly accelerate. You can do hill repeats on your forefoot, but the vast majority of your running, you probably need to use your whole foot. And so those I think are the big ones for America, you know, particularly. Gotcha. And they might be universal. I mean, like, a lot of minimalist runners will run around their forefoot, or have been taught to run in their forefoot, and that's kind of almost worldwide. But, you know, America tends to double down on things.
Like you said, bigger, better, faster.
Yeah.
So this is a question, I guess, for you that you may or may not know, but why do you think more people, whether it be, you know, run form specialists, gait specialists, why do you think more people don't have the systemic view of the body and the mind that you do, and they look at things, you know, more in isolation with respect to, you know, purely, you know, the musculoskeletal system, things of that nature?
Because it's hard.
Yeah, makes sense.
And it's not taught. So, you know, the relationships through your body aren't taught at medical school or on a medical-based paradigm. You know, you're rewarded for specializing and subspecializing. And, you know, there's an orthopedic surgeon that'll just do one procedure for one particular injury. We were rewarded for knowing more and more and more about less and less and, well, smaller and smaller things. Yeah. You know, that's called specialization. So to be a generalist or a big picture person can be very, very hard. In America, it's really, really easy. In the US and you know, to be anywhere where there's medical insurance absolutely rules, dictates what you can and can't do. I mean,
sure.
I've very often helped people with foot injuries by working on their upper cervical spine and helping them with their neck. And I mean, you know, if that's fraud, you know,
yeah,
insurance is paying for the treatment, not the person. So
yeah,
you know, so I you know, it's really interesting. Harvard came out with this paper, you know, Harvard Medical School, and you know, they're very pleased with themselves, and they came up with this really, really novel concept that if you have a hip injury, you should assess the knee and the foot as well. Like, you know, obviously.
Right. It's like one on one.
But this was like, we're way underestimating the influence of the knee and the foot, and we should take this into consideration. So I think it's extraordinary how segmented and siloed medicine has got, and that's across the professions too. It's so difficult to get the doctor to work with the surgeon, to work with the physio, to work with the nutrition.
Sure.
So yeah, it's along those lines.
Yeah. I think at least in the US here, you sort of the catch-all term for that is often used as wellness, right? Again, I think it's everyone has their own definition of that.
Yeah,
And again, I think people will say, "Oh yes, that's important. Oh yes, that makes sense." But I think there's very, very few people in reality really appreciate it to the level that you do, and certainly practice it to the level that you do. So
yeah. Yeah, and I think you got to be really careful. So I've been kind of chiropractors were considered alternative medicine. We were very medically trained. Great grounding in anatomy and physiology and the basics and pathology. Like, so very. I mean, my brother's a doctor, and we were just parallel trained. I mean, I felt I could, up until about third or fourth year, pass all his exams.
mm,
And I used to say to people, there's no such thing as alternative medicine, because if it really works, medicine will include it.
right.
Because we want to make a difference. Generally, we hope that we're all trying to make the world a better place and make a difference. So I think you could be really, really careful, because I was trying to explain this to a physio that was taking umbrage with the way I was saying, because I was saying, you need to breathe properly, and I don't know, held tension when you're running is not a good idea, and they're not sure about that. But I said the thing is that I feel people are specifically in running are very, very frustrated with the current model. People are very injury prone. The one athlete that I worked with in 3.5 years had 13 MRIs.
Wow.
And many athletes feel that they get injured every 6 months. And the reality is, if you want to be a world-class runner, you probably need to be uninjured for at least 5 to 10 years. You need continuity. And so I think people are frustrated, and I think people have really, really applied themselves to, let's say, a more mechanical sort of, I've done my rehab, I do my stretching, I do my drills, I've done the things, and realize, well, I didn't get anywhere. I mean, that's who ends up on coming to me. So that's obviously, I'm seeing a biased point of view.
Sure.
I'm seeing the people at the end of this journey that are frustrated and nothing's changed.
Yeah.
But what is dangerous so the better the modern medical people can be, the less need there is for alternative medicine or alternative practices.
Mm-hmm.
And so I often tell, like, doctors, don't get frustrated when your patients are seeking and reaching outwards. Realize that that's a sign that they're not getting enough from the current paradigm.
Yeah.
Which I know is kind of weird, because I'm also there are a lot of people who, because it doesn't work, then provide solutions that possibly aren't I try really hard, work within science, within neuroanatomy, with anatomy, biomechanics, and physics, and really, really try to stay true to root modern medicine. Yet it seems very alternative, but that's not the same as, it's not woo-woo. It's not,
Right.
I get people to deeply respect their anatomy and biomechanics, not disrespect, modern medicine. I'm not. I don't know. I'm waffling a little bit, but it is interesting. This. Be careful when you do look for alternative sources of information, because a lot of them are quackery, or a lot of them are counterproductive, or a lot of them can be harmful in the long run. Nail the fundamentals is kind of where I'm at, and how important the fundamentals are. But most people don't know what the fundamentals are.
Yeah. Yeah. So going back to sort of, again, at least how the US views gait analysis and running form, there's so many whether it be apps or information out there to assess running form, and there's lots of different running form certifications even. This is how you run this way, don't run that way. Any thoughts on that, specifically as far as things that maybe generally speaking they get right or they get wrong, or just your thoughts as a whole, as far as when someone says a firm stance on, okay, Lawrence, this is how you're supposed to run this, always do this or always do that, or don't do this, don't do that. Any thought on that, or again, any specific areas that maybe runners should be paying attention to when it comes to, I don't want to say things in isolation, but specific things with their gait?
Well, how I work is teaching people really how to trust their mechanics. So teaching proper hip function and really trusting that hip function and knowing exactly what that hip does. Let's say, or for your ankle, like one of the examples I use is like people, like I have really skinny wrists, endurance runners wrists. So if I had to punch someone, I'm going to punch it with a straightly aligned wrist. If I punch with a skew wrist, it's going to hurt, right? And yet people have terrible ankle biomechanics. And then again, this notion is, oh, you control it through strength, but often it's yeah, strength helps, but a lot of it's a technique or learning how to stack your joints and how to have the right posture in running. And when those joints stack up, we become more efficient. The muscles work the right amount. We're not tight and held. So primarily how I work is helping people understand their body better so that things fall into place. And a lot of the time, the athletes I work with find this frustrating because I'll say, oh, look, this got corrected in your run. And they said, I didn't know we were working on that. And I said, well, we don't bring it to your attention. My job is to see it fall into place. And then we welcome it in. And it's very, very difficult for people to understand that. Okay. And so I basically don't give cues. I have there's YouTube resources where we do your posture and we talk about angel versus zombie so that you understand how you should show up when you run. But generally speaking, I don't give cues. I try and give structure and form so that you can figure out movement and learn to trust your movement patterns. Okay. So now I know that's a long-winded story, but basically most people work the other way around. They'll say, oh, well, this angle should be that angle, or
sure,
we've noticed that you have this sort of, and then they try and correct it. The interesting thing is people move the way they move for reasons, and I'm trying to help them get to the bottom of the reasons, not tell them what's wrong with them. Okay.
Right.
So how we show up in the world is a product of your entire lifestyle, who your parents were, what you ate, any traumas, where you went to school, what your coach said, all of these things that we've accumulated over a lifetime. It's not my job to judge you. And, like if I'm depressed, when my head's forward, my chest is collapsed, I don't say stand up straight. I go and ask the person, are you okay? Okay. Yeah. Why are you not inspired? Why do you not feel open-hearted or so along those lines is why I don't really like to judge people's running. And this is ubiquitous. So people want to work with me and say, can I send you a video for a running assessment? And I'm like, I kind of don't like doing that. I try and give you the tools so that you can show up better.
Yeah.
So that would be that. I think where common mistakes that I see that I don't think are a really good idea is dorsiflexed feet in running, because apparently, the theory is if you dorsiflex your foot, you'll increase your gait cycle or decrease the lever arm in your gait cycle, increase your turnover. And you want to relax the front of your ankle when it recovers through and have as little tension in your ankle as possible in the air, because it relaxes your hip. And why do you want to relax your hip? Because we don't want hip injuries and we don't want low back injuries, and it affects your breathing. So when you relax the front of your ankle, the front of your hip relaxes, your breath relaxes, and we want relaxed breathing. So that I think there's a nuance of cadence or turnover where people are really, 180 got into the collective consciousness that that's a good number. And I think people are very variable. So shorter people can have much higher turnover than taller people with long legs. But again, I don't try and tell people to increase their cadence. I think cadence is a transverse movement shut down somewhere. So we need to be, somewhere you're not really good at transverse movement and therefore your cadence isn't appropriate. I think engaging core is really, really dangerous in terms of running. Depends how we engage core. Some people can do it kind of safely, but what you don't want to do is pull your belly button in to engage your core, because you end up with ribs up, diaphragm up, and you have to, that's paradoxical breathing, which will put you in a state of anxiety or fear, and make you guarded and defensive or a version of all of that, but it's absolutely linked to back pain. Okay, so when you breathe in, it's just basic biomechanics. Your ribs must go up and your diaphragm must come down. And for that diaphragm to come down, your belly has to expand. And so we don't want to engage our core with the belly in, because it means diaphragm up and ribs up. And that's a pathological breathing pattern. What else? Yeah, I think the notion of keeping your hips still, your pelvis and hips should be animated and strong. So, when it's really difficult to explain to people that haven't really thought about this pelvic mechanics, but if you think about your femur needs to translate down into extension and rotate internally through your gait pattern. And it means sort of the opposite hip has to rise. And I think a lot of people are trying to keep the hips very still when they run. And that again is tension, and it shuts down those mechanics. And then again, you can have this front-sided bias where your ankle's tight, your hip flexor's tight, you're keeping your pelvis still, you're trying to keep your chest square. Your sternum should really rotate from side to side. Running is rotation. Running is twisting. We shouldn't try and make the twist happen with our upper body, but it has to be able to express itself. And if it doesn't, we create shear forces in joints where we shouldn't. So like an example would be, you keep your chest and core very still and engage and your hip still, you're going to twist your knee excessively. And, hips you shouldn't have rotation at your knee. So that's one of the ways of where I think people go wrong with excessive cues of trying to be static or held, or increase tension. Like it's so easy to put tension into someone's body with a cue, and you can spend the rest of your life trying to get that tension out of the joint or out of the moving pattern. So I literally, in the stage of evolution of my journey, I know I'm going on a bit. At one stage, I stopped giving any flexion cues, any cue that involved flexion, because those are cues that we store trauma in flexion. We were in the fetal position from a whole lot of neurological regions. I just don't give flexion cues very easily. And I don't give any cues that'll impede the breath, because breathing is a priority, and calm, relaxed breathing is a kind of a basic fundamental human right. Because it's like Maslow's hierarchy of needs. That's safety and security. You do not want, I would hate to think that anyone had a bad breathing pattern, or a breathing pattern that put them in a state of distress or insecurity or anxiety from our side. And what else? And then I stopped cueing tension. Then once I said to myself, I am no longer going to cue flexion, tension, or restricted breathing. Then I thought, like, well, what other cues are there? And I thought, like, yeah, they're not that many.
I solved them all.
Yeah. Now I kind of don't really cue people very much, other than offer a basic framework of how to stack your posture and shift forward when you run.
Yeah. Well, that's so interesting what you said about the spine. So in our running certification, we discussed the spinal engine model, and I remember getting feedback from someone that said, I guess to your point, it was always run rigid, everything's gotta, and they're like, what? Like the spine's supposed to move. It's not like this, rigid, pole, like metal pole. It was really interesting. It was really
Well, I'm glad you teach the spinal engine model. And these are like logic gates. So if you make the first assumption is wrong, everything else underneath it can be right, but it's still wrong. And I think it's really, really difficult to think very, very far upstream. And there's no doubt that our spine needs to be animated when we run. And the problem is that then a lot of cues suddenly don't make sense. Why would you keep your pelvis still if you want an animated pelvis? Why would you, I don't know, really prioritize stiff ankles and tight reactive hips if it shuts down an undulation in the spine? And so you start playing that game, and it's a lot.
Yeah. So you've mentioned this multiple times that, athletes might, kind of give resistance, maybe not so much like you said on the elite end, because they're like, okay, look, if you can make me better, great. I don't care if it's voodoo or whatever it is, just do it. But are there any, I should say maybe the best way to put this, do you encounter resistance a lot from athletes as a whole when they come to see you? Obviously, like if they're coming out of desperation, maybe not, but I didn't know if, some of your athletes might view it as like so contrarian that like, oh, this can't be right. This can't, if it were this quote unquote simple, why hasn't anyone ever done this before? Like, why are you the first person telling me this?
Yeah, totally. I mean, I've met with a lot of resistance. I feel like we got really powerful tools to help change people's running now. And I'm almost getting enough of a reputation here in the US that, the one person I said, look, I'm different, I'm contrarian, you got to understand this, blah, blah, blah. And then she said, Lawrence, I will do anything that you tell me to do. I'm just so grateful you're working with me. Which is, oh, yeah. But no, I mean, I've had sort of like death threats on Instagram. Someone told me to end my life and delete my account. And so, yeah, and I've got the biggest resistance is often from people involved in the athlete's team. So often the athlete will say, I like this is amazing, but their team's not coming with on the journey. So the coach is like, no, this is the way. Or the strength coach might say no, because we're going to do bird dogs and planking and pile of presses and through the wazoo, because that's or a PT. So often athletes that end up working with me end up if they're in quite a strong paradigm, they'll leave that paradigm or change people that they work with. So it can be very disruptive. I think the biggest thing is as well, people say they want change, but they hate change. So change is really, really hard. And like I say, if you really invested, imagine putting 10 years into drills, your strength, your gym, and then someone comes up and says, hey, we a lot of the athletes that I work with now, I'll say, we're going to just stop strength in the gym and rehab for 3 to 4 months, 3 to 4 weeks. Just because you're putting so much new input in, and they need to sort of ride that wave, and that first opportunity of change is normally the best opportunity of change, that we just sort of take a break and then we layer it back on again, and sort of try and protect the movement patterns that we have. So there's a lot of resistance, and in Boulder, when I moved here from Laguna Beach, I used to fly up and treat a lot of athletes, and when I moved to Boulder, I actually emptied out I see less people now that I live in Boulder than when I was out of town. Because out of town, Lawrence was nice. He came in, made me feel better, jumped off the table. I went back to doing what I was doing. In town, Boulder, Lawrence, you come in a week or 2 weeks later and they say, yeah, you're kind of not going the right direction. This is tightening up. This should be opening up. And a lot of athletes want not the best choice of word. They want enablers. They want, you've got this, let's go. They're so used to people cheering them on. Yeah. It's very difficult when, and I explain that to athletes, and it's one of the reasons I'm so guarded in pulling people's form apart, is that I guess I know what a healthy joint feels like throughout your whole body, and we're always trying to move towards that direction. And when athletes sort of stray off the path, I'm going to say, come, we need to get back on the path. Or why is your hip tightening up? It should be opening up. Why is your breath, why does your breath keep going out of pattern? We need to solve this. It's a problem, and a lot of athletes don't want to solve problems, or it's too much, or it's fearful. So yeah, it can meet extraordinary amounts of resistance, and some athletes, really think I'm very, very wrong. Because it's that contrarian to what they're doing, but yeah, that's, and I don't have to tell athletes that much anymore, but for me, I'm done with trying to prove I'm right. I'm done with being antagonistic. I'm done with all of that. I'm really, really happy with my process. We're going to launch an online workshop now, which will help people run, and we've got an online community. And I don't need the friction or the arguments anymore, or trying to prove a point, or trying to show people that I'm right. We have people that have, like I said, the 13 MRIs since I've moved to Boulder, they haven't had a single MRI. They haven't had an injury since. Yeah. And we see the performance breakthroughs again and again. These aren't anecdotes of one, or not something I've seen one time. This is life-changing. People's whole perception, their confidence changes. I'm just so blessed and grateful to be where I am, and the knowledge that I've got, that I don't want any sense of antagonism. I just want to share help. We're going to put a lot of energy into YouTube with it, explaining, and trying to help people for free, and just give as much positivity and improve movement as much as possible, because it's really, really important. But yeah, it really gets up some people's nostrils.
Yeah. Well, it was so interesting. Some of the feedback that I got in person after the running consideration.
Yeah, tell me.
Yeah. Well, from one of the attendees in particular, they're just like, they were just blown away. They're like, holy crap. They're like, how, like, it was like, they were blown away because the way how you, especially, kind of like you're doing on a podcast, the way how you explained it is so common sense. It just absolutely makes sense. You're like, what have I been doing with my whole life, basically? Kind of thing. In terms of running, it was really interesting, and I certainly
Yeah.
felt the same way. It was just it was pretty incredible feedback, and
Oh, nice.
and there was a lot of that as well that we got
Was there
on calls
antagonism
as
to
well.
it? Where people, I mean, people say I'm dangerous, or you can get hurt doing what I suggest.
No, all of ours, all the feedback we got was I can't believe I didn't kind of connect the dots sooner,
Yeah,
kind of to what you were talking about. And oh yeah, or that totally makes sense, that everything kind of works as a systemic whole and you
yeah,
can't isolate these things. So yeah, no, it was
okay,
great feedback.
yeah.
Um,
Because I
so
think a way, sorry, I'm interrupting you, but I think a
oh
way of
yeah,
thinking of this is like, the science pendulum swings and it swings hard and it can swing very abruptly. And, from like someone is antagonistic to me and saying you can't say, I said, listen, I'm just telling you, like the pendulum of science has swung here. And if it swaps over, don't get caught out of position.
yeah,
And like, I'm sorry, I've been working with runners. I was very blessed that for whatever reason, running chose me. I was in fourth year. I was a fourth year student and I was working on world-class athletes. And our course was 6 years, and then it took me another 18 months to qualify after that. So by the time my practice opened, I was already treating Olympic gold medalists. Like Olympic gold medalists were flying into town to see me because people couldn't
mm,
be. So that's, for whatever reason, I worked with elite athletes while my brain was still being educated
yeah,
there. Anyway, I just been walking this middle road.
yeah,
Like now, when I got to American, I was kind of like, wow, that's pretty extra. Or I'm sure that's, I worked with sprinters. I'm like, that's a sprinting cue. Why would you tell an endurance athlete that? You know what I mean? Like,
yeah,
I just think that, and we've seen this with diet. First it's carbohydrates to death, then it's zero carbohydrates, and it's as much, ride fast. It's complicated, I know, but I really do think that like the middle road, and we sort of got ahead of ourselves, or I don't know. It's what I try and do is absolutely respect the basic anatomy, the basic biomechanics, the real fundamentals, and that's why it makes common sense, because it is common sense.
right, right. Well, I just had this conversation with my partner Cindy about just maybe life in general, but the
Yeah,
way how most things operate, and they operate on the bell curve, right? Like
yeah.
exercise, for example, if you don't do
Yeah,
any, probably not a good thing. If you
yeah,
do 1,000 miles a day, probably also not a good thing. Like,
yeah,
but I think that for most people, because they're just not even aware of it, that while you're in that center of the bell curve, they can't even appreciate it, until they hear someone talking about it, because they don't even know it exists,
yeah.
so it's great that you're bringing these things to light. Um,
Oh,
so lastly, based off of the athletes that you see coming to you out of desperation or whatnot, um, are there any commonly held beliefs or myths that you see on a recurring basis? Again, maybe it's a US based thing, I don't know, but any things that, if there's like, one or two or three things that you commonly see runners doing that's incorrect, in that just might be like a long-standing myth, or is it more just individual based?
no, I think there's very common. We kind of discussed the core
Yeah.
or the static spine, which is also head center, keeping your head still in the midline. I think your head has to track over your foot when you run. I think the commonest thing is underestimating breathing and your breathing pattern. You have to learn ribs up, belly, diaphragm down, which means big belly, which basically you almost have to arch as you breathe in and round as you breathe out. And I've just had an athlete now who sort of figured it out and has been fine for, I don't know, months.
Mm,
And then traveled and it was under a bit of stress and the breathing pattern flicked the other way around. And so I think having a daily practice of rounding and arching and working on your breathing and sticking to it as like you brush your teeth, is really, really important, because you can flick into reciprocal breathing or stuck breathing pattern and not recognize it. And trust me, things will start not going well for you. So, I mean, that right through your immune system, your sleep, your digestion, never mind your movement patterns. So I think that's the most, like, honestly, 9 out of 10 people come in with bad breathing.
mm,
So really, really focusing on healthy breathing, it would be huge. And then learning how to properly use your hips. And we use the sort of the double combo of backward walking. We call it contralateral gait. So your belly button should face your knee when you walk. You shouldn't walk like a grizzly bear, which is like, like walking like this. You need to have equal and opposite. So I think those as well, when you traumatize, when you sit in an airplane, when you drive a lot, when, I don't know, you fall on your butt snowboarding or whatever, it's very, very common to see that movement pattern disappear. So I think the big deal would be check in and make sure every day that your breathing is healthy, and reinforce healthy breathing patterns. Make sure that you understand and can do contralateral gaze, and that you practice that daily as well, because when it disappears, you won't know.
Yeah.
And I think, and then sort of thinking about making sure that, you have sort of some sense of releasing tension or head over foot. And if I've got the one athlete, he's very good. I mean, he went to the Olympics for triathlon, and we kind of talk about posterior chain and anterior chain as descriptive terms, and he's anterior chain based, but he can run and sustain very high levels of running. And, I prefer to see it more posterior chain based, or on a spectrum shift across. But because he breathes well, gets his head over his foot, and has great contralateral hip patterns, he hasn't been injured in a year either, and his training's really, really consistent. Whereas before, when I met him, he'd been stuck in an injury pattern for a long time. So there is this, I think, this loosely held, or this big picture, and then you can start figuring out according to, Rick's idea of running. But make sure you're breathing well, head over foot, and you understand proper healthy hip function.
Gotcha. It was really funny, actually. Tadej Pogacar, as you know, is arguably the best cyclist in the world. There was I saw a picture of him online, and he was it was just belly breathing, if you will. And one of the comments was, it's incredible he can go so fast when he's so fat. It was great. It was a great comment.
Yeah, there's I mean, like one of my athletes now was working with a bike skills coach, and he says, you need to engage your core. And she said, and she's one of the best cyclists in the world, right? She's like, nothing. No, do not give me cues about body or posture. Yeah, I breathe. I focus on breathing. And if you go back, you can actually Google, like, Tour de France riders with really, really, because your spine's relatively static on the bike from anterior to posterior, because you're sitting and you're holding on handlebars, right? Their bellies, to really, really breathe deeply, you see how big their bellies are distended. And, like a lot of people have been cued to keep their core engaged, or even possibly their belly button drawn in towards their spine to keep their core still when you're at a spin class. So I don't know how it got into the culture, but, now you're telling people, which is engaging your core on the bike is kind of the same as telling someone to not breathe. You know what I mean? Or breathe in a way that's going to make you anxious and uptight, and shallow your breath and overventilate. I wouldn't want to say hyperventilate, but overventilate,
Yeah, no, for sure. It was, and the comment just struck me, because obviously they weren't aware of belly breathing, and it was just like, wow, it's amazing he can go uphill when he's so fat. It's just incredible. Like, and all the comments were like, he's breathing.
And one of the most powerful modifiers of our movement is cosmetics. Is we want to appear shredded, and so people will engage in tense muscles to look, but like that probably comes from you're not comfortable with your personal body, or you're not comfortable with your personal appearance, or movies, and you see these sort of shredded Wolverine, and you think, well, that's what I'm going to look like. And at the Olympics, a lot of athletes are in really good shape, but they got there by doing the work. They didn't, we talk about it a lot with ground contact time, or elite athlete tendon stiffness, or with turnover. The elites have these natures. Well, that's a product of the work that they've done, right? And don't conflate what is a causation and correlation. Like, rich people drive Bentleys. Buying a Bentley doesn't make you rich. You've got to do the work so that you have such excess money that you can buy a Bentley and not care.
Sure.
So I think that got into running a lot, is these externalities that distract us from the work that you're supposed to be doing.
Yeah. Well, no, I think you're right. I mean, this is sort of going off on a slight tangent, but there was this thing I saw online. It said, it was talking about, like, like Navy SEALs, all these like special forces operators. In the movies, they're all like, The Rock, they're all like 6'5", huge, ripped. And they said, anyway, this picture showed two pictures. It was like someone from the movies, and then what a normal operator looks like, and
Yeah,
they're
yeah,
kind of these like small nerdy looking guys, you
yeah,
know,
yeah. Super
and then
smart,
super
think on their
smart.
feet, very creative,
Right. Totally. And
solve
it's like,
problem in the real time.
yeah, but it's like, exactly, but it's like the illusion of for the movies, right? Which becomes then reality as far as how
Yeah,
people want to look is
yeah,
like, if I want to be a badass,
yeah, yeah,
I gotta have a six pack and be shredded and so on and so forth. So I'm sure you're absolutely right that, you know, some
yeah.
of that comes from that idealization of what the body is supposed to look like based off of those types of things. So
Yeah, and unfortunately for us, right, you know, the bigger you are and the deeper the voice, the more people believe you, you know. So you know, the highest paid actor in the world is Dwayne the Rock Johnson, and you know, the biggest podcasters all or Tony Robbins, and they're all, you know, big chest and deep voice and very convincing.
yeah, yeah. Guess I won't be there anytime soon with my thin wrist. Um, Lawrence, thank you so much for your time. This has been awesome, and hopefully we can have you on again the podcast another
Oh,
time.
thanks, Rick. I
Um,
really appreciate it.
yeah, for our listeners that want to learn more about Dr. Lawrence van Lingen, you can go to his website, lawrencevanlingen.com, to learn more about his services, more about his philosophy, things of that nature. For anyone on the USCA side of things who's looking to become certified, you can use a code ATE75 for $75 off. So thank you so much, Lawrence, for your time on the podcast today. This has been great, and hopefully we'll chat again soon.
Yeah, look forward to it, Greg. Thank you so much. And everyone, move well, run well, learn to trust your movement. It's a gift for life.
Thanks so much, Lawrence.
Okay, take care.
All right.